Hello, welcome to another University of Houston Y UHCOP series. I'm Nikisa Sapp, the Director of Pharmacy Recruiting, and today we have Dr. Zhao. I'll let her introduce herself.
Hi, everyone. My name is Dr. Alexa Zhao. I'm one of the clinical assistant professors here at the college in the PPTR department, which is the Pharmacy Practice and Translational Research department. So that's me.
Awesome. We are so glad to have you for today's session. And so I always start with the first question is just to tell us a little bit about yourself, like where you went to school and where you did your residency. Just tell us who you are.
Sure, yeah. And I think, we have a lot of faculty that are UH alums, which is amazing. But I am one of the ones that is not. So my story, I actually went to undergraduate school and pharmacy school in South Florida at Nova Southeastern University in Fort Lauderdale, Florida. And from there, I proceeded to complete a postgraduate year one residency at Oklahoma State University Medical Center in Tulsa, Oklahoma. I went there for a very specific reason. One of my interests in pharmacy is HIV, so I kind of followed a journey there to pursue studies there. After completing my PGY1, I furthered my education and training and completed a postgraduate year two residency through the University of Houston. And that it was an HIV pharmacotherapy ambulatory care residency. And so that was kind of in conjunction with the University of Houston. And I spent a lot of time through that program at Texas Children's Hospital at their pediatric retrovirology clinic, in addition to a private HIV clinic here in the city of Houston.
Nice. So before you came to that part, what about before, like undergrad or high school, or why or what was it about the pharmacy profession? Like, how did pharmacy choose you, or how did you choose pharmacy?
That's such a good question. And, I do think about it often because I was one of those people who started having an interest in pharmacy pretty early on. I actually grew up in Indianapolis, Indiana. And so while I was in school there in my early, high school years, I had an amazing chemistry teacher, and she used to be an emergency department nurse. And she would always share just these crazy stories of patients she encountered, and just, a lot of different things about healthcare that kind of started making me think all the way back then that healthcare just sounded like a really rewarding profession, something within healthcare. And I got to searching and kind of looked at what qualities different health professions kind of valued and needed, and where kind of my personality fit in. And I also had a friend's sister who was a pharmacist, actually. And I really, really looked up to this person. She was kind of just a role model for me. And I really liked, how passionate she was about her profession. So kind of those two things coupled, I started exploring different careers in healthcare, and really resonated with a lot that I was finding when I was reading about what pharmacists do. Mainly, just their value on the team, on the medical team. I really loved how much you need to be very granular. You need to be very, very detail oriented and have an appreciation for that kind of thinking as a pharmacist. And that just really resonated with me because I can be very, particular with things, and just a lot of different reasons why I felt, maybe exploring this field, looking at, wow, with a PharmD, when I looked at what a doctorate of pharmacy does and what they can do, there's all these different fields. It's not just one path. There's just a number of different things that one can pursue with this one degree. And so the freedom to explore there with this one degree just really excited me. And I knew that this was a career where I could really make a difference in people's lives. And I could also kind of really be engaged in like the science of things. So I think that's kind of how I pursued pharmacy starting in high school, and I went into undergrad thinking that I would be pursuing a pharmacy degree. So I kind of went into a pre-pharmacy program.
Nice. You sound like you have a passion for it. Absolutely. And normally, if you were an alum of UHCOP, you would probably answer this question with some bias. But you don't have that bias because you did not attend the University of Houston as a pharmacy student. So, what can you honestly say about everything you've learned, like when you came to Houston? What stands out about the UHCOP program, or what stood out about the program and or its students to you?
Yeah, and when you added that last part and students to you, that's kind of, what really did stand out to me first and foremost before anything else was the students. Because when I was a postgraduate year 2 resident in the area, I spent a lot of time facilitating different activities with the pharmacy students at UHCOP. And I was just so impressed by them. I was impressed by their knowledge base. I was impressed by how professional they were and how invested they were in the profession already as students. And even, I was engaging with P1 first year pharmacy students. And I was just really impressed with their just, mentality about pharmacy. And so that's really one thing that stood out to me. I felt like, okay, what is this program doing that's breeding these types of students that, and not to say other programs are not that way, but it just really, really stood out to me here. And so furthermore, I spent a lot of time with the faculty as well through my, residency program. And I just felt like it was such a family type of environment, both within the faculty and also within the student body. And on top of that, you just can't really beat Houston's diversity. And in addition to that, when you look at the college, you can't beat the College of Pharmacy's diversity. And I mean that in a lot of different ways, like just the experiences that the different types of students that join our program have. It just creates for such great learning grounds and great, just building as a team together. I think there's just so much perspective and so many different experiences that come into each organization, to each classroom, to each, faculty meeting, whatever the case is. And you can just really tell that, with all those different perspectives, you're able to learn a lot more. You're able to just appreciate a lot more. And I feel like we're growing so much as a group because of everything, all the unique things that each individual person can bring to the table. So all those things I think just really stood out to me about this program and made me I really wanted to be a part of it. I wanted to buy in, I wanted to get in, I wanted to grow and be a part of this great program.
It's a great answer, and it's almost as if you're leading me to the next question, if you didn't already answer this. So what do you enjoy the most about teaching here at UHCOP?
So the first thing that comes to mind is definitely just the ability to engage with the students, the ability to have really meaningful conversations with students here, both about the coursework and just in general. Like, I love being able to kind of talk through what people's concerns are. What are they worried about? What things are they looking to improve about themselves as they proceed in their pharmacy journey? Like, how can I help them? And just those opportunities to help and kind of be a part of students' growth is something that I really cherish here. I also think that one of the things I love about teaching here is just the freedom that we're kind of given to explore our passions, and also how infectious that can be to the students, because they really love when all of us very diverse faculty in our own experiences share what we're passionate about. And so that engagement back and forth is really fun, and it's really exciting to see, students think, well, hey, I never thought about this. Maybe I want to explore this a little bit more. It sounds very interesting. And I just love that camaraderie that we have between the students and our faculty.
I agree completely, even as staff, because I'm not teaching them, but to watch their growth from the beginning. They're not necessarily scared, they're not necessarily immature, but to watch the maturity level, right? To watch them come into their own and be more confident, it's amazing. And I know we're both excited about what we do, and we talk about it just great. And of course, there are days where they're not so excited, right? They're not,
Mhm.
they're a little downtrodden, and they're a little, they question, the choices that they
Of
made of coming
course.
to pharmacy school. And I even love the part or the role that I get to play in encouraging them, lifting them up, continuing them to go further. Everyone gets a little defeated and everyone gets a little downtrodden, but guess what? We're there to help pick them up and then, let them fly. So I feel the exact same way as you.
Yeah, I
So
totally agree.
the so the last question I will ask is, just words of advice or encouragement, or what would you lastly like to tell students who are watching this who might be pre-farm, or not even considering pharmacy yet, but just curious. What would you tell them about the pursuit of pharmacy, or words to get them to that next level?
Sure. And that's a good question. And I think, you know, to answer that, I feel like one of the pieces of advice I would say to anyone that's either considering pharmacy, or, maybe they already know they want to pursue pharmacy, but maybe they're not exactly sure why. I mean, I don't know what the reason is, but I would say one of the things that I would suggest is just go out and talk to pharmacists. And I say more than one pharmacist, because it's really helpful to get an insight into what you may be doing for the rest of your life. um, it's hard to do that by just reading about professions, and by looking at the prerequisites of what's required, and well, I think this is what I'd be doing. And also, not just that, but I think you'd be amazed at if you're able to kind of somehow get in, either volunteering, shadowing, or just stopping in at your local pharmacy, whatever the case is. Try to just engage with some pharmacists and just find out what their day is like. Find out what makes them tick, what things they love about their job, maybe what challenges they have with their career, those types of things, because there are so many avenues that you can go down in pharmacy. And I think one thing that a lot of people who are not in the field already don't know is just that. I think from the community perspective, like from the general public, what a pharmacist does is kind of this one image, right? Like of a person in a white coat behind a counter, like handing you your medication. But pharmacists actually do like a plethora of other things, and to really high capacities. Like they're some of the decision makers in some hospitals and some different environments. So if you can just kind of try to explore those areas a little bit more, ask questions, um, you know, find out what it is that people do from the day to day, more than just what you might imagine pharmacists do. I think you'll be very surprised, and you may be even more inspired to pursue the profession, because it's growing and we are gaining steam in a lot of different areas, and it's a really exciting profession to be a part of. And last thing I'll add is, I think students may have heard that the profession is a little bit hard to break into in certain areas right now, which I don't think is false. I think that I will say with any profession, there's always like a wax and wane where the supply and demand don't always kind of align. And so that may be the case right now, but that won't always be the case. And if you're really passionate about what you want to do, nothing will stop you from getting a position. And I will also add that our university specifically has very high placement rates. We invest a lot in our students, and so I think they're really, really well prepared for once they leave and graduate. So those are some tips that hopefully will help you in your pursuit and your career.
Excellent. That's such a great way to end our session today. I think, Dr. Zhao, you make me want to change the series to Keeping It Real with Dr. Zhao. So maybe more series together. You said a word earlier that I just thought about, that for the first time, this is actually a good word, right? But you said the word infectious. And so talking to you, having more faculty like you would definitely, that infectious attitude and that excitement to teach our students is what they need. And our students are so lucky to have you. So thanks for joining us today. We'll bring you back again because I'm sure you're going to be a favorite, and hopefully we'll talk some more. So thank you so much, Dr. Zhao. Have a great day.
You too. Thank you so much, Miss Sapp. Go Cougs.